You're watching ABC4 News.
When it comes to our health, each phase and age is important and presents their own specific challenges. Today we're talking about specific needs as we get older. Dr. Cynthia Lawler from St. Mark's Hospital Senior Center joining us today to talk about what she does and the important service she offers. So Dr. Lawler, let's talk about what is a geriatrician?
I get asked that a lot. Geriatrics is a specific part of primary care that deals with the problems of aging and the medical issues that elders have. As a geriatrician, we often have special training or more experience taking care of seniors. I personally did my training up at the U in the geriatrics department.
Such an important area right now, especially when it comes to COVID-19 and this coronavirus. What are some of the biggest concerns that your patients are bringing to you when it comes to the discussion of this pandemic?
Yeah, that is a great question. Honestly, seniors are scared. Every day I go to my clinic and I see these amazing seniors who are really towing the line in terms of following the protocols to keep themselves and others safe. They are wearing masks, they are staying at home, but they're still scared and they have reason to be. Right now we are really in a crisis in this country. We are having surges like we've never seen before, higher cases every single day. In fact, in Utah right now, the highest percentage of cases of COVID are amongst those 20s, 30s, and 40s. And what our seniors want is for them to be as safe as they're being. We know with scientific evidence that wearing masks dramatically reduces the transmission of COVID. Right now is a really important time to follow in the wisdom of our elders and wear masks, be safe, keep each other safe.
I love that, the wisdom of our elders, because they've seen a lot, way more than we have.
Yes, they have.
And they know what is best. What are some of the other ramifications of COVID-19 that you are seeing with your older adult patients? Obviously, there is the physical part of it all, but let's talk about the emotional toll it's taking as well.
Yeah, that's been a tremendous increase in my practice. Every day I'm seeing more and more people who are really anxious and depressed as well. Honestly, when I talk to my colleagues in medicine who take care of all ages, depression and anxiety has increased across the board. But one thing that I think seniors experience uniquely, which we can't understand, is they're actually contemplating dying from a disease, dying from a virus that hopefully they won't contract. That's a really big deal and very anxiety producing. The other thing is they're alone a lot, they're isolated. A lot of times they live alone. And one of the messages I want to put out there is this is the time to reach out to our neighbors, to our older adults, to people who you know live up the block from you and are probably alone. Call people regularly. Drop by and some pictures of grandkids. Keep a safe distance, of course, and wear your masks, but don't leave them alone. Show them how to do video chats. These are all things that can help reduce the isolation. Another problem I'm seeing, in addition to the higher rates of anxiety and depression, is people who are getting inactive. One of the worst things you can do as a senior is sit around and get weak. Part of getting older is loss of muscle mass, and once that kicks in, it's really hard to turn around. So another thing we can do to help our seniors is encourage them to get out and take walks in safe environments, or give them some videos of safe exercises aimed at geriatric care and aimed at things that they can do to get stronger again. This is not the time to sit around and get weak.
No, it's not. Dr. Lawler, such important information that you're sharing with us today. Thank you so much for being here. If you want to learn more about St. Mark's Hospital and all the work that they are doing there, we've got a link for you online at abc4.com. And doctor, thank you so much for what you're doing for our older generation. We do appreciate it. Coming up, there are a lot of